The gentleman from Vermont, Mr. Welch, is recognized for 5 minutes.
Thank you very much. You know, the question for us now is, what can we do and how best do we do it? And if I understand, and this is directed to Dr. Fauci and Dr. Redfield, is that the two essential things are testing and the social distancing or quarantine or separation, keeping us apart from one another. Is that more or less correct?
Yeah, I would put the social distancing and other issues of preventing infection ahead of the testing, but the testing is very important.
And let me go on the testing, because I heard two different emphasis from each of you. Dr. Redfield, you were, as I understood it, focusing on the doctor-patient relationship and the doctor triggering the test in response to a request from a patient. Dr. Fauci, what I understood you to be saying is that surveillance testing is very useful, and we're seeing that with drive-through testing. Am I correct in describing a difference?
Yeah, there is a difference, but we should be doing both.
Well, that's what I'm saying then. Do you agree with that, Dr. Redfield?
Yeah, CDC is, you know, we have multiple surveillance systems for respiratory disease and flu. I think we have, you know, multiple different systems we use along.
We don't want to hear about that. We got to,
no, but
this is right now with this virus. What should we be having our states like Vermont be doing surveillance testing and figure out how to do that in the next question?
What I was trying to say is we're now moving the COVID-19 into that system. We started with the 6. We're going to expand jurisdictions.
So yes or no, should we, in addition to be doing the individual testing, the surveillance testing?
We should be doing both. I agree with Dr. Fauci.
So information, data is power, correct?
It's critical, and that's what I've said, I think, at the last part of the hearing now.
You did.
The system was geared for the individual doctor-patient. What we're going through now transcends that. We need to do more than that.
There's a public health issue. So a person who presents has got a problem, but it's a problem that, unfortunately, that individual is going to share with a lot of other folks. Correct?
Yes, and when that individual is confirmed, it triggers the public health response around that individual.
Let me keep going, because one of the things we have to get here, all of us represent folks who are going to be getting sick. So this is not a red state, blue state type of deal. We're all in this together, and in fact, if we're not in it together, we'll all get sick together. So on this question of travel, which is one of the big issues, you know, the president is banning travel from a number of European countries. Does it make sense to exclude a single country, Great Britain? Dr. Redfield? Is there a medical reason to do that?
We were looking at the extent of new cases in different areas, and the reason that Schengen area, because there's no borders.
I don't have that much time. Okay. I'll tell you, I'm mystified. If you have a number of European countries where there's a travel ban, I can accept that if that's a medical recommendation about how to combat this. But then you have one country that's singled out for exemption, even though the cases in that country are higher than a number of others. How does that medically make sense? I'll ask you, Dr. Fauci.
Well, I'll do it quickly, hopefully. So when we were looking at the pure public health aspect of it, we found that 70% of the new infections were coming from, of the new infections in the world were coming from Europe, that cluster of countries. And of the 35 states, 30 out of 35 of them who were more recently getting infections were getting them from them. That was predominantly from Italy and from France and from Germany.
Okay, thank you.
So when did this, no, I mean, there is an answer to your question. Okay. So when the discussion was, why don't we just start off and say banned from Italy? We were told by the State Department and others that, in fact, you really can't do that because it's sort of like one country, the whole European thing. And the reason I believe that the UK was left out was because there is a difference between the ease of transportation between the European countries and the UK.
That's Brexit. Thank you. But